Hello, it's Dr. Rhonda Johnson. Today is Wednesday, March 27th, 2024, and this is part 2 of my message on ageism. Well, it's a fact. People are living longer in every country in the world. Did you know that in 2024, most of the world's older people live in China, followed by India, followed by the United States, and Japan? So what is ageism? The World Health defines it as how we think, which is stereotypes, how we feel, which is prejudice, and how we act, which is discrimination toward older people or to people based upon their age. Now, ageism is very prevalent. In fact, 1 in 2 people are ageist toward older people. Ageism can pit one generation against the other. Ageism tends to be more accepted and challenged less than other isms. A key point that I want to make today is that ageism can be combated, and educational interventions are just one of the effective strategies for reducing ageism against older people. So let's pause for a second and talk about healthcare. In healthcare, sometimes older people are treated unfairly. Sometimes the healthcare team might not be as patient or even respectful to older people. Other times, older people are left out of the most important healthcare decisions that affect them, and older adults can be left out of clinical trials. Another example is when people talk to older people in a way that sounds like they're talking down to them as if they were toddlers or children. That is called elder speak. So, be careful how you talk to older people, because ageism can be a form of unconscious bias. Now, age discrimination, for example, it can cause a decline in job opportunities as people get older. Age-related forced retirement can hinder a person's ability to pay for their basic needs, such as transportation, housing, groceries, and medications. I believe the more we talk about ageism, the more we can dismantle it as a first step. So I want to share some myths and facts about aging. One myth is that older adults are set in their ways and can't learn new things. Well, the fact is that seniors are capable of adapting and learning new things. So, and doing so can have positive health benefits, such as improving their memory and cognition. Another myth is that all older people end up with memory problems or dementia. Well, you should know from my dementia series is that's not true. Dementia is can be preventable. Another fact is that older people, another myth rather, is that with old age comes depression. Well, the fact is that depression isn't just confined or a natural or inevitable part of aging. In fact, younger adults tend to have higher rates of depression than their seniors. Another myth is that older adults should be more sedentary so they can avoid accidents and falls. Well, here's the fact is that people can continue to be physically active as they age. And in fact, it's never too late to start being more active. And exercise can improve your physical and your mental health, as well as help you to manage chronic conditions such as diabetes and high blood pressure and lower your risk of cancer. Just be sure to choose exercises that you enjoy and can stick with, and always check with your doctor before starting any type of new exercise program, particularly if you've been sedentary. So that's my part 2 message on ageism. I hope that it begins to make us all think about how we interact with people who are older today and in the future. Take care, folks.